Hello friends, welcome to Nursing Guide. Today we are going to discuss about RRB exam MCQs. First question is, which of the following lobe of the brain is affected earliest in the most of cases of Alzheimer's disease? Option A, temporal lobe. Option B, parietal lobe. Option C, frontal lobe. And option D, occipital lobe. And the correct answer is option C, frontal lobe. Frontal lobe is affected earliest in the most of cases of Alzheimer's disease. The next question is, which of the following is the earliest sign of Parkinson's disease? Option A, disturbed vision. Option B, forgetfulness. Option C, tremors. And option D, muscle stiffness. And the correct answer is option C, tremors. Tremors is the earliest sign of Parkinson's disease. Next question is, drug of choice for heparin toxicity. Option A, sodium. Option B, atropine. Option C, protamine sulfate. Option D, adrenaline. The correct answer is option C, protamine sulfate. Protamine sulfate is the drug of choice for heparin toxicity. The next question is, penicillin prophylaxis is needed for option A, typhoid fever. Option B, rheumatic fever. Option C, rat fever. And option D, yellow fever. And the correct answer is option B, rheumatic fever. Penicillin prophylaxis is needed for the rheumatic fever. The next question is, which eye structure receives stimuli and sent to the brain? Option A, retina. Option B, sclera. Option C, lens. And option D, iris. And the correct answer is option A, retina. Eye structure of retina receives stimuli and sent to the brain. Now, next question. The most appropriate and safest way to verify the patient identity before administration of the medication. Option A, state the name of the patient aloud and ask him or her to repeat. Option B, check the room number and bed number of the patient. Option C, check the patient identification band. Option D, ask the patient his or her name. The correct answer is option C, check the patient identification band. This is the most appropriate and safest way to verify the patient identity before administration of the medication. The next question is, which of the following term is used to describe edema of the optic nerve? The options are option A, angiouretic edema. Option B, glaucoma. Option C, papilledema. And option D, lymphedema. And the correct answer is option C, papilledema. Papilledema is the term used to describe edema of the optic nerve. The next question is, the neural tube defect among newborn can be prevented by providing option A, folic acid to the mother in the first trimester. Option B, vitamin K to the mother in the first trimester. Option C, iron and folic acid throughout pregnancy. Option D, iron to the mother in third trimester. And the correct answer is option A, folic acid to the mother in the first trimester. Next question, one pocket of oral contraceptive pills contain option A, 15 pills. Option B, 28 pills. Option C, 13 pills. And option D, 25 pills. And the correct answer is option B, 28 pills. In the contraceptive pill packets are 28 pills. Next question. A colostomy in the right side of the colon is known as option A, dry colostomy, option B, wet colostomy, option C, double barrel colostomy, option D, loop colostomy. And the correct answer is option B, wet colostomy is the right side of the colon is known as. Next question. What is the approximate rate of the hair fall per day? Option A, 20 to 50 hairs per day. Option B, 50 to 100 hairs per day. Option C, 100 to 150 hairs per day. Option D, 200 to 250 hairs per day. And the correct answer is option B, 50 to 100 hairs per day. This is the approximately rate of the hair fall per day. Next question. Mechanism behind the development of edema in burn patient. Option A, increase papillary permeability. Option B, due to renal failure. Option C, increase fluid administration. Option D, decrease urine output. The correct answer is option A, increase capillary permeability. Next question. Weight gain, nausea, and a decrease in urine output are the manifestation of option A, myocardial infarction, option B, pericarditis, option C, right-sided heart failure, option D, left-sided heart failure. And the correct answer is option C, right-sided heart failure is the manifestation of weight gain, nausea, and decrease in urine output. Next question. Which type of leukemia commonly affects the person younger than 15 years? Option A, acute myelogenous leukemia. Option B, acute lymphatic leukemia. Option C, chronic myelogenous leukemia. Option D, chronic lymphatic leukemia. The correct answer is option B, acute lymphatic leukemia. Next question. Medical management for intracranial pressure includes option A, administer half-strength saline. Option B, administer plasma volume expanders. Option C, administer mannitol. Option D, reduce the number of breaths in the ventilator. The correct answer is option C, administer mannitol. Medical management for ICP, intracranial pressure, is administer mannitol. Next question. Which of the following vitamin is known as anti-sterility vitamin? Options are A, vitamin A, B, vitamin D, C, vitamin E, and D, vitamin K. The correct answer is option C, vitamin E is the anti-sterility vitamin. Next question. Inflammation of the tissue surrounding the nail is known as option A, clubbing. Option B, chylonychia. Option C, pyronychia. Option D, oncholysis. The correct answer is option C, pyronychia is the inflammation of tissue surrounding the nails. Next question. Longest vein in the human body is option A, great saphenous vein. Option B, pulmonary vein. Option C, portal vein. Option D, hepatic vein. And the correct answer is option A, great saphenous vein is the longest vein in the human body. Next question. A childhood behavior problem is option A, questioning. Option B, always playing. Option C, talkative. And option D, temper tantrum. And the correct answer is option D, temper tantrum. temper tantrum is the childhood behavior problem. The next question, while teaching a patient with COPD regarding exercise, the community health nurse should emphasize is option A, rest in between exercise, option B, avoid exercise, option C, exercise strenuously, option D, take medication in between exercise. The correct answer is option A, rest in between exercise. This is the COPD patient's advice. Next question, a client is being maintained on heparin therapy for deep vein thrombosis. The nurse must closely monitor which of the following laboratory values. Option A, clotting time, option B, bleeding time, option C, platelet count, and option D, activated PTT. The correct answer is option D, activated PTT. Activated PTT is seen in heparin therapy. Next question, the first priority in the management of trauma patient. Option A, maintenance of an adequate airway. Option B, control of hemorrhage. Option C, maintenance of adequate arterial blood pressure. Option D, ruling out a spinal injury. The correct answer is option A, maintenance of an adequate airway is the first priority management of trauma patient.